Hi everybody, this video of mine is about peripheral artery disease, which is also called peripheral arterial disease, abbreviated as PAD. This is a common circulatory problem in which narrowed arteries reduce blood flow to your limbs. When you develop a peripheral artery disease, your extremities, usually your legs, do not receive enough blood flow to keep up with demand. This causes symptoms, most notably leg pain while walking, which is known as claudication. Peripheral artery disease is also likely to be a sign of a more widespread accumulation of fatty deposits in your arteries, which is known as atherosclerosis. This condition may be reducing blood flow to your heart and brain as well as your legs. You often can successfully treat peripheral artery disease by quitting tobacco, exercising, and eating a healthy diet. Now let me tell you the symptoms. While many people with peripheral artery disease have mild or no symptoms, some people have leg pain when walking, which is known as claudication. These claudication symptoms include muscle pain or cramping in your legs or arm that is triggered by activities such as walking, but disappears after a few minutes of rest. The location of the pain depends on the location of the clogged or narrowed artery. Calf pain is the most common location. The severity of claudication varies widely from mild discomfort to debilitating pain. Severe claudication can make it hard for you to walk or do other types of physical activity. Peripheral artery disease signs and symptoms include painful cramping in one or both of your hips, thighs, or calf muscles after certain activities such as walking or climbing stairs. Leg numbness or weakness, coldness in your lower leg or foot, especially when compared with the other side. Sores on your toes, feet, or legs that won't heal. A change in the color of your legs, hair loss or slower hair growth on your feet and legs, slower growth of your toenails, shiny skin on your legs, no pulse or a weak pulse in your legs or feet. Erectile dysfunction in men also can be there. If peripheral artery disease progresses, pain may even occur when you are at rest or when you are lying down, which is known as ischemic rest pain. It may be intense enough to disrupt sleep. Hanging your legs over the edge of your bed or walking around your room may temporarily relieve the pain. If you have leg pain, numbness, or other symptoms, do not dismiss them as normal part of aging. Call your doctor and make an appointment. Even if you don't have symptoms of peripheral artery disease, you may need to be screened if you are over age 65, over age 50 and have a history of diabetes or smoking, or if you are under age 50 but have diabetes and other peripheral artery disease risk factors such as obesity or high blood pressure. Now let me tell you the causes. Peripheral artery disease is often caused by atherosclerosis. In atherosclerosis, fatty deposits, which are known as plaques, build up on your artery wall and reduce blood flow. Although discussions of atherosclerosis usually focus on the heart, the disease can and usually does affect arteries throughout your body. When it occurs in the arteries supplying blood to your limbs, it causes peripheral artery disease. Less commonly, the cause of peripheral artery disease may be blood vessel inflammation, injury to your limbs, unusual anatomy of your ligaments or muscle, or radiation exposure. Coming to the risk factors. Factors that increase your risk of developing peripheral artery disease include smoking, diabetes, obesity, that is body mass index over 30, high blood pressure, high cholesterol, increasing age, especially after reaching 50 years of age, a family history of peripheral artery disease, heart disease, or stroke, high levels of homocysteine, a protein component that helps build and maintain tissue, can also cause peripheral artery disease. People who smoke or have diabetes have the greater risk of developing peripheral artery disease due to reduced blood flow. Now let me tell you the complications. If your peripheral artery disease is caused by build-up of plaques in your blood vessel, you are also at risk of developing critical limb ischemia. This condition begins as open sores that do not heal and an injury or an infection of your feet or legs. Critical limb ischemia occurs when such injuries or infection progress and cause tissue death, which is known as gangrene, sometimes requiring amputation of the affected limb. Stroke and heart attack. The atherosclerosis that causes signs and symptoms of peripheral artery disease is not limited to your legs. Fat deposits also build up in arteries supplying blood to your heart and brain. Now let me tell you how you can prevent it. The best way to prevent claudication is to maintain a healthy lifestyle. That means Quit smoking if you are a smoker. If you have diabetes, keep your blood sugar in good control. Exercise regularly. Aim for 30 to 45 minutes several times a week after you have gotten your doctor's okay. Lower your cholesterol and blood pressure levels if applicable. Eat foods that are low in saturated fat. Maintain a healthy weight. Now let me tell you the diagnosis of PAD. Some of the tests your doctor may rely on to diagnose peripheral artery disease are physical exam. Your doctor may find signs of PAD during a physical examination, such as a weak or absent pulse below a narrowed area of your artery. Whooshing sounds that are known as bruise over your artery that can be heard with a stethoscope. Evidence of poor wound healing in the area where your blood flow is restricted, and decreased blood pressure in your affected limb. Another test which we commonly do is ankle brachial index, that is ABI. This is a common test used to diagnose PAD. It compares the blood pressure in your ankle with the blood pressure in your arm. To get a blood pressure reading, your doctor uses a regular blood pressure cuff and a special ultrasound device to evaluate blood pressure and flow. You may walk on a treadmill and have readings taken before and immediately after exercising to capture the severity of narrowed arteries during walking. Ultrasound. Special ultrasound imaging techniques such as Doppler ultrasound can help your doctor evaluate blood flow through your blood vessels and identify blocked or narrowed arteries. Angiography. Using a dye, which is a contrast material, injected into your blood vessels, this test allows your doctor to view blood flow through your arteries as it happens. Your doctor is able to trace the flow of contrast material using imaging techniques such as X-ray imaging or procedures called magnetic resonance angiography (MRA) or computerized tomography angiography, that is CTA. Catheter angiography is a more invasive procedure that involves guiding a catheter through an artery in your gland to the affected area and injecting the dye that way. Although invasive, this type of angiography allows for simultaneous diagnosis and treatment. After finding the narrowed area of a blood vessel, your doctor can then widen it by inserting and expanding a tiny balloon or by administering medication that improves blood flow. Blood test. A sample of your blood can be used to measure your cholesterol and triglyceride and to check for diabetes. Coming to the treatment. Treatment for peripheral artery disease has two major goals. First major goal is manage symptoms such as leg pain so that you can resume physical activities. Secondly, we need to stop the progression of atherosclerosis throughout your body to reduce your risk of heart attack and stroke. You may be able to accomplish these goals with lifestyle changes, especially early in the course of peripheral artery disease. If you smoke, quitting is the single most important thing you can do to reduce your risk of complications. If you have signs or symptoms of peripheral artery disease, you likely will need additional medical treatment. Your doctor may prescribe medicine to prevent blood clots, lower blood pressure and cholesterol, and control pain and other symptoms. Coming to the medications. Cholesterol lowering medication. You may take a cholesterol lowering drug called a statin to reduce your risk of heart attack and stroke. The goal for people who have peripheral artery disease is to reduce low density lipoprotein LDL, that is bad cholesterol, to less than 100 mg per deciliter or 2.6 millimoles per liter. The goal is even lower if you have additional major risk factor for heart attack and stroke, especially diabetes or continued smoking. High blood pressure medication. If you also have high blood pressure, your doctor may prescribe medication to lower it. A blood pressure reading given in millimeters of mercury has two numbers. The top number in the reading measures the pressure in your arteries when your heart beats, that is known as systolic pressure. The bottom number in the reading measures the pressure in your arteries between beats, that is known as diastolic pressure. Your blood pressure treatment goal should be less than 130 over 80 millimeters of mercury. This is the guideline for anyone with coronary artery disease, diabetes, or chronic kidney disease. Achieving 130 or 80 millimeters of mercury is also the goal for healthy adults age 65 and older, and healthy adults younger than age 65 with a 10% or higher risk of developing cardiovascular disease in the next 10 years. Medication to control blood sugar. If you also have diabetes, it becomes even more important to control your blood sugar, and that is glucose level. Talk with your doctor about what your blood sugar goals are and what steps you need to take to achieve these goals. Medication to prevent blood clots. Because peripheral artery disease is related to reduced blood flow to your limb, it is important to improve that flow. Your doctor may prescribe daily aspirin therapy or another medication such as clopidogrel that comes with the name of Plavix. Symptom relief medication we can also prescribe. The drug claudication increases blood flow to the limbs both by keeping the blood thin and by widening the blood vessel. It specifically helps treat symptoms of claudication such as leg pain for people who have peripheral artery disease. Common side effects of this medication include headache and diarrhea. An alternative to ciloxazole is pentoxifylline. Side effects are rare with this medication, but it's generally less effective than ciloxazole. And the next option is angioplasty and surgery. In some cases, angioplasty or surgery may be necessary to treat peripheral artery disease that is causing claudication. First, I'll tell you about a little bit about angioplasty. In this procedure, a small hollow tube catheter is threaded through a blood vessel to the affected artery. There, a small balloon on the tip of the catheter is inflated to reopen the artery and flatten the blockage into the artery wall, while at the same time stretching the artery open to increase blood flow. Your doctor may also insert a mesh framework called a stent in the artery to help keep it open. This is the same procedure doctors use to open heart arteries. Bypass surgery. Your doctor may create a graft bypass using a vessel from another part of your body or a blood vessel made of synthetic fabric. This technique allows blood to flow around or bypass the blocked or narrowed artery. The thrombolytic therapy. If you have a blood clot blocking an artery, your doctor may inject a clot dissolving drug into your artery at the point of the clot to break it up. In addition to medication or surgery, your doctor likely will prescribe a supervised exercise training program to increase the distance you can walk pain-free. Regular exercise improves symptoms of PAD in a number of ways, including helping your body use oxygen more efficiently. Now I'll tell you a little bit about lifestyle and home remedies. Many people can manage the symptoms of peripheral artery disease and stop the progression of the disease through lifestyle changes, especially quitting smoking. To stabilize or improve PAD, you should stop smoking. Smoking contributes to constriction and damage of your arteries and is a significant risk factor for the development and worsening of PAD. If you smoke, quitting is the most important thing you can do to reduce your risk for complications. If you are having trouble quitting on your own, ask your doctor about smoking cessation options, including medication to help you quit. Exercise. This is a key component. Success in the treatment of PAD is often measured by how far you can walk without pain. Proper exercise helps condition your muscle to use oxygen more efficiently. Your doctor can help you develop an appropriate exercise plan. He or she may refer you to a claudication exercise rehabilitation program. You should eat a healthy diet. Heart-healthy diet, low in saturated fat, can help control your blood pressure and cholesterol levels, which contribute to atherosclerosis. Avoid certain cold medication. Over-the-counter cold remedies that contain pseudoephedrine and coming with the name of Advil cold and sinus constrict your blood vessel and may increase your PAD symptoms. So you should avoid these medicines if you are suffering from PAD. Careful foot care. In addition to the suggestion which I mentioned before, you should take good care of your feet. People with peripheral artery disease, especially those who also have diabetes, are at risk of poor healing of sores and injuries on the lower legs and feet. Poor blood circulation can postpone or prevent proper healing and increase the risk of infection. You should take good care of your feet by washing your feet daily, dry them thoroughly and moisturize often to prevent cracks that can lead to infection. Do not moisturize between the toes, however, as this can encourage fungal growth. Wear well-fitting shoes and thick, dry socks. Promptly treat any fungal infection of the feet, such as athlete's foot. Take care when trimming your nails. Inspect your feet daily for any injury. Have a foot doctor podiatrist treat bunions, corns, or calluses. You should see your doctor at the first sign of a sore or injury to your skin. There is some alternative medicine which is known as ginkgo. That is, the blood thinning effects of ginkgo may allow people with intermittent claudication to walk longer distances with less pain. However, this herbal remedy can cause bleeding when taken in high doses, and it could be dangerous if paired with antiplatelet medication, including aspirin, that are commonly prescribed to people with PAD. So do not take ginkgo before talking with your doctor. I hope you like this video of mine. If you suffer from PAD or any other illness, please comment on this video and I'll try to reply to your comments as soon as possible, and if I get a time, I'll make a video about your illness. And you know, if you have not subscribed my channel, please subscribe and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think my video provides some sort of benefit to you, please like the video and share these videos through social media so that other people can be benefited. Thanks for watching this video. See you in next video. Bye for now.